And I would say that is illustrative today of the scope of the problem. It's a U.S. problem, it's a global problem, it's a problem everywhere. So in many of our conversation and work and discussion, it's not only about U.S., but it's about everyone. Now, that being said, I would argue that we have major players here in this room working both in U.S. and globally. And the whole idea of a movement moving together is to move forward to address many of these issues. And so what I'm going to talk about next would be, very briefly, what we're hoping to accomplish, what we expect to accomplish by creating accelerated movement that already exists to really start making a difference. So in that regard, I just want to put those things in perspective. I don't need to tell you anything more than the previous panels already made very clearly. It's a global health crisis, it's an equity crisis. But it's a global partnership, as Judy said, radical partnership that all of us need to work together. So this grand challenge, which I told you was launched late 2019, early 2020, when we have a smaller group of people just come together and say, what do we need to do in this area? Spend about a good 6 months or more of planning with many of you to say, what do we take on? It's such an important issue, such a big one. And consequently, we decided we're going to look at 5 strategic areas. But let me first tell you about how this grand challenge is put together. It's chaired by Judy Roden. You already met her, heard her a number of times. And of course, we have over 200 collaborators and more across several of our initiatives. It's true public-private partnership because it's very clear from day one when we decided what's a grand challenge. It's a big idea, it's a spacious goal, which cannot be done by one sector only, certainly can be done by national academies and academics, but it involves private sector, government, you name it, to come together. So we're partnered with the U.S. administration. Thank you, John Balbus, for your leadership. And of course, Admiral Rachel Levine and your office. We partnered with industry, you already heard from Pam, and of course, many other industry, really large number of CEOs and others. We partner with academia, health delivery systems, you name it. And our 5 areas that we thought that's really important is 1, get the message out there. And yesterday we heard from the climate summit how important it is to message out there. And of course, health is what everybody cares about. I said yesterday, the average American, average individual cares about 3 things: their health, their finance, and their security, safety. So putting that as a highlight, we need to find ways to message it right. And the message, of course, is not only it's an urgent issue, but as we heard yesterday, there's hope. That if we work together, solutions can make a difference. And that's why they communicate. It's to the public, but also it's to our healthcare workers. They all need to be educated, understand this. It's also, in fact, for them to educate their patients to act what they need to do. So a big issue is communication. Second, as you heard today and this morning, the collaborative. We brought together people to say, how do we actually act together? As you already heard, that in fact we, as a health system, care for patients with chronic disease because of climate effect. We, as a health system, are there to respond and prepare for emergencies. We, as a system, work with communities to make them more resilient. And we, of course, have fundamental issues. So getting health systems together to, quote, decarbonize, to do our share, is really important. Third is, as Judy has talked about, the fact that many sectors are contributing to climate change, and some more than others. Many sectors are talking about what do we do to intervene, mitigate? How do we look at the emission and reduction and the economic impact? But few sectors say, what are we doing in health? And the question is, at the end, it's all about human dimensions, as you said many times. So if we can bring that lens to all sectors to work together, to look at the co-benefits, that was Tamer's word, right? And the trade-offs. Because we're not sure every intervention that makes sense is good for health. But at the end, it's really human health and well-being. So a roadmap to go forward with multi-sectoral framework. Of course, research innovation. This Monday, we had a meeting talked by, as Becerra talked about, what's the research gap, what a research agenda. We're going to go forward, thank you, Seema, to in fact having a research agenda for everybody to look at and finding inequities. You can have a whole section talking about, really at the end of the day, it's really what we care about. How do we help communities? How do we help people who's going to be affected? And also in our academy, we have a program called Climate Communities Network that you hear more about. You already know about this. While we're doing good, we sometimes may be doing harm. 8.5% of total carbon emission in the United States come from the health sector. And I don't need not to tell this learning audience about scope 1, 2, and 3. A lot of discussion in the early breakout, but what do we do about scope 1, scope 2, but important scope 3? But importantly, we recognize that we need to work together as a group to address this issue. And therefore, out of the 5 strict areas, we created the collaborative action, from intent to action, John, right, on how to decarbonize the health sector. And this one is co-chaired by Rachel Levine, George Barrett, who's here, you'll hear from later, and Andrew Whitty. True public-private partnership to bring together hospitals, clinicians, payers, distributors, academia, you name it. And many of you are part of this, to look at how we can work together. As you can see in the map over here, that we have 4 different working streams. One on healthcare delivery. Second, on private sector supply chain. Third, on education, communication. And fourth, on policy finance metrics. You're going to hear from several of them. For example, we all know about healthcare delivery. We need to redesign healthcare. Already mentioned, heard about inhalers and CO2 gas, you name it. But also, we heard a lot about supply chain this morning, and of course, the need for us to think about a way towards looking at how to reduce carbon emission in that area, education. But I want to have a shout out on policy, finance, and metrics. Liz Fowler's here, and of course, CMMI has just released team that she's going to tell you about. John Perlin's here, because John has talked about Joint Commission in trying to move forward certification. And Don Berwick is the third co-chair. And from Don Berwick, we learned about movement. How do you mobilize the entire community on this? But just to tell you that in 2 years, we've done a huge amount of stuff. You know, they're about highlights. I think someone mentioned about 70 products. We have about 30-some products that include carbon clinics, repository, journey map, how do you reduce greenhouse emission, helping OCHI about the ROA, the Catalyst program, to make the business case, and of course, I mentioned already about Joint Commission and CMS. What I want to do today is just end by saying, now we're poised. We're poised, we have done all the foundations. It's time for action. Now, we have made a commitment as a group, the 50% reduction, 2030, and 100 net zero by 2050, but it's time for action. So how do we move that forward? First and foremost, if you think about the 5,000 hospitals in the nation and the clinics and the healthcare organization, if we all believe this is important, let's begin to make commitment and let's begin to act. This is where we learned from Don Berwick, because Don Berwick, 25 years ago, after the IOM or NAM released to As Human, the medical errors in hospital, he says, how do I mobilize the community before a mandate? 100,000 Lives campaign. The whole idea is that everybody can play a role, everybody can come under this big tent. Now, you can do your share. You're not ready yet, just come along. And you're ready, let's go. And so the whole idea is to start a movement or to accelerate a movement that already exists through, as you hear, my next slide, number of people working one. Our idea is to get a big tent. We support everybody's work. We want to bring it all together, find common grounds, coordinate, and move forward. So the idea, of course, is to make commitment to climate and health. Now, look at all this efforts that's already ongoing. You're going to hear from some of them. We love them because they're doing all the right things. But as been said in our breakout this morning, there are all these things. How do we actually move together? Who do we listen to? And these are different size groups. So our idea is to bring together, I mentioned here, Healthcare Without Harm, Kaiser Permanente, IHI, New England Journal of Medicine Cooperative, the HHS Pledge, and OCHI, the Joint Commission, CMS, and everybody can work together under this big tent. So we are serving as a coordinating body. We have only one ambition, to do the right thing with all of you. Not to replicate, not to supersede, but find ways in which, has been discussed, if there are different standards, let's find a place to say, can we learn from each other and create guidelines for each, which will be common standards. So connections, opportunity, highlight the achievement, access to resources, landscape, and of course, learning from each other. That's what we're going to do. So today, I'm launching this moment, the accelerated movement. Thank you. Clap. Thank you. Now, look at this. Even before launch, we have hundreds and hundreds of people sign up already. We're just still counting the heads. Hopefully, after the launch, we'll have a lot more. And thank you, John, because your pledge started at large number. We're going to work with you, but we're going to continue this, right, in looking at the large number that's already signed up, and hopefully a lot more. Question, of course, oops, can you go back one slide? Okay, QR code. You want to join? Just look that up. Did I miss a slide? Can you go back one? All right. Yeah. Okay, so what we're going to do is ask anyone who wants to join. This is a big tent. And start learning about this area, because we'll be a resource. And then we are also have a project working with Healthcare Without Harm and others called the Vanguard, that's going to have a group of people measuring, started working together. But we're going to ask you to also create a brief survey to all these things that you can see here. I won't have time to read it. For those who want to join, we just need that information. And of course, QR code. I do want to end by saying, if you look at the number of sponsors, you can see how excited people are. Well, you know, everything takes resources. But the fact that I can call my friend here, my friend there, or talk to someone I don't know and say, you know what we're trying to do? And people are signing up, public, private foundations, industry, academia, and so many of you. I just want to thank all of you for doing this. So here we are. That's why this is such a great day. We're getting, thank you. And we're going to keep that movement forward, and you're going to have the rest of the day to take a little bit more detail of each one of those areas we're working on. And Adam, we can work with you on the Climate Week.